Today we're going to talk to Dr. Vann about dry eye syndrome. So, Dr. Vann, what is dry eye syndrome?
Dry eye syndrome is a condition where your eyes are irritated because you don't either produce enough tears or you have irritation from medications, you have irritation from contact lenses, you have irritation from surgery. It's basically a condition where the eyes are not hydrated on a consistent basis properly.
Okay, so you pretty much listed all of the causes there. What are some of the symptoms that I might experience if I have dry eye syndrome?
Most ironic part of dry eye syndrome, or dry eyes in general, is your eyes tend to water if your eyes are dry. People would think, well, if my eyes are dry, they're going to feel like dry skin and itch. That is a situation people do experience, but a lot of people have watery eyes because their eyes are irritated, and their eyes are irritated because they're dry. So symptoms of itchiness, like dry skin, or watering can either one be a symptom of dry eyes.
Okay, and how do you diagnose dry eye syndrome?
Honestly, listening to the patient is the most effective way, because you can hear things like when I read, the words run together after a while, or you can hear I wear my contacts but later in the day I have problems, or I stare at a computer all day and as the day wears on my eyes are not as clear. You know, that is the symptomatic part of it is the easiest, just by listening. Clinically, there are tests we can do to actually measure how the tear film behaves. We can look at the cornea and see cells on the cornea that look just like dry skin. So that's how we do it clinically.
Okay, so if I suspect that I might have dry eye syndrome, how seriously should I take this problem?
Actually, it's more serious than most people realize. It is the most underdiagnosed condition of the eyes that we see. And the reason it's fairly serious is because it only gets worse as we get older. And usually that's because of things that add to that over time. Medications, unfortunately, being one of them. But just the natural changes in the tear film as time goes on, it gets worse and worse. So treating it early and getting some habits established is kind of a big deal.
So what are my treatment options for dry eye syndrome?
Your treatment options traditionally have always been lubricants, like teardrops and maybe some ointments. And now we have a lot of different drops and gels and ointments. We always try to steer you toward the more preservative-free products because none of us want to drink a glass of swimming pool water. We'd rather have a glass of filtered water, and that's really what you're doing to your eyes. So we steer toward the more preservative-free products. But we also have things like fish oils, omega-3s, that you can treat yourself from the inside out. We also use something called punctal plugs, punctal occlusion. That kind of scares people when we start talking about punctal plugs, but it really is a simple procedure that's very successful, and we do it right here in the exam room. It takes 10 or 15 minutes. And last, there's medications. Restasis has been around for a long time. That's one of the treatments. Unfortunately, those medications tend to be quite expensive and usually aren't always covered by insurance. But those are kind of the four groups of treatments. There's kind of a new horizon where we actually do some lid massaging of the glands, which also helps. We also do some warm compresses that help the glands to secrete better. So we're learning more and more all the time on how to treat this if we listen to the patient and hear the problem and then go from there clinically.
Okay, tell me more about these punctal plugs, because that's not a word that, everyday people really know. So what does that mean?
There are little drains in the corners of your upper and lower eyelids where the tears drain into your nose and down your throat. That's why when you cry, your nose runs. So those drains sometimes get exceptionally large for some people, depending on their genetics and their medical history. So it really sucks the tears right off the surface of the eye, and therefore your tears don't hang around long enough to do what they're supposed to do, or you put gels, ointments, drops in, and they just wash right away. So what the plugs do is they slow the process down. They're literally like putting a cork in the drain so that we can keep the water and the tears and everything on the eye longer, and they don't wash away as quickly. So they work very, very nicely, and the newer generation of plugs are very, very problem-free. So it's been a nice addition to our clinical treatments.
And is this something I have to come and get done one time and then I'm done, or how does that work?
Traditionally, the plugs have been something we put in actually in a two-step process. We do a temporary plug first to make sure your eyelids don't have any reaction, which I've had probably 2 of those in 10 years. Then we put in what's called a permanent plug. Well, the permanent plugs always have been something you put in and they stay there until we remove them or they fall out. The problem with the real permanent plugs is they have been known to cause a few challenges. And they came out with some new ones that are what we call semi-permanent, and they dissolve over 6 months. So the insurance companies have embraced these new semi-permanent plugs because they have almost zero complications. So yes, you come back every 6 months, we put the new ones in, they last that 5 to 7 months, and then we do it again.
Okay. So with any of these treatments, would I still be able to wear contact lenses?
Probably can wear contacts better with some of these treatments than you can, without. The drops and gels, some of them we can actually use with your contacts. I'm a big advocate of using tears when you get up and tears when you go to bed, whether it's gel or drops or whatever. Treat the eye, not just the contacts. But most of the preservative-free or the low preservative stuff we use, you can use with your contacts. Plugs, absolutely you can wear contacts. Omega-3 fish oils have no effect on the contacts. Restasis and those medications have to be used, outside of the contacts, but you can still wear contacts after the medication has had time to settle. But yeah, contacts are better with some of these treatments.
Okay. We already talked about this some, but let's get into this more. What potential issues could I run into if my dry eye syndrome goes untreated?
There are some fairly critical corneal conditions where, the cornea is the windshield on your eye. And if you clean your windshield on your car, guess how much better you can see? Well, if we don't take care of the windshield on our eye, your cornea, then it will deteriorate optically and you won't see as well. So a lot of that stuff is irreversible. Some of it develops as people age, no matter what we do, but dryness contributes to really complicating conditions that you inherit or just the natural aging process of the eye. So you definitely want to pay attention and respect it, because it can get to the point where you can't wear contacts, you can't have any kind of surgery done, you just have to baby your eyes and wear your glasses because you have no other alternatives if the condition gets bad enough.
Okay, and I gather that omega-3 fish oils are a way to prevent dry eye syndrome from ever starting. Is there anything else that you would recommend, from the prevention side, as far as, keeping this from becoming an issue in the first place?
The omega-3 fish oils, I probably would say prevention might be a little strong. Helping your eye naturally to produce better tears so that it prevents some of the problems, yes, absolutely. And the fish oils really vary from quality product to very poor quality product, so that's kind of a can of worms. We like to tell people exactly what works the best from what our research tells us. Omega-3 fish oils are the #1 supplement sold in the United States, and there are so many bad ones out there, people don't really realize that. Also, as far as prevention, humidifiers in the wintertime, keeping the humidity in your house up in the wintertime is a big deal. Using, like I said before, the drops that are more preservative-free make a big difference. I'm not talking just necessarily about twists, that people may realize those little twist disposable tears get kind of expensive, but there's some bottle products now where the preservative evaporates or disintegrates when the light hits it, so those have been great. And then using the products. We talk about how to treat dry eye, and 6 months later I see the same people back with the same symptoms because it gets better and then they quit. Dry tears, dry eyes, inadequate hydration, those are all conditions that don't typically get cured. We just treat them. Another thing is water intake. People really should drink half their weight in ounces every day in water, and very few of us do that. So, but that helps to hydrate as well.
Okay. Is there anything else that you think I've missed? Anything you'd like to add in regards to dry eye syndrome, how we treat it here in our office? Anything else?
Dry eyes cause more complication with quality of vision. People come in and say, well, I'm having a little blurry vision when I read, or it's a little blurry at night. Dryness is a break in the tear film. We call it dry eye syndrome, but it's really dehydration of the tear film. So if you are looking at the television at night and you blink and it improves, you're experiencing a problem with your tear film. If you are wearing contacts and you seem to get a little blurry and you blink and it improves, same story. So anytime that your eyelids actually help the vision when you blink, you're experiencing some of the dry eye syndrome or dry eye symptoms. I would encourage people who have some of these issues or questions, especially eyes watering, they think, well, they can't be dry. That is probably the biggest false assumption that a person can make. So get with us, get with your eye doctor, and let them help you decipher some of these things. There's always things we can try, not always solutions, but at least treatments.
Okay, thank you very much.
Yes, thank you.